I'm Dr. Doolittle, and I'm going to be telling you just a little bit about sleep hygiene, about how to sleep a healthier way for your spine to keep your neck straight, your spine straight, make sure that all of your joints are supported. So typically, there's two different ways that we would prefer you to sleep on, either your back or your side, and some people do a combination of both. We don't like sleeping on the stomach because then your head has to rotate quite extensively, and then that puts a lot of pressure on all the nerve roots, the spinal nerves that come out the other side. It can also create a vertebral subluxation, meaning that the vertebrae will get out of place, and then you have to go to a chiropractor to get it put back in place. And ideally, we just want to keep the spine very healthy, keep those nerves healthy. So I'm going to tell you a little bit about first side sleeping. So if you're female, we know that we have wider hips, and so we need to support our knees more. So ideally, we should be able to have a pillow that whenever it squishes down, it could be a nice big fluffy pillow if you'd like, that's more comfortable. But by the time it squishes down, then it's about the same distance of support as what your knees normally are. So here's hip width apart from me. So my pillow needs to be about that wide by the time it squishes down. So it starts out pretty big and then squishes down to about that size. Now also, when you're sleeping on your side, we don't want the pillow to be like a queen size pillow, a smaller pillow. We want it to be a longer king size pillow. The reason why is because we also want the feet supported. For example, as you can see, my feet, if I have a shorter pillow and it's only supporting my knees, now see how my hip rotated? So ideally, we want both the knees supported and the feet supported. Now, on my head, this is where we're going to be showing you how the distance between your shoulder to your neck, your cervical spine, really needs to be what decides the size of your pillow as you're sleeping on your side. So we don't want it to be too thick, and then see how it's rotating my head up, and now I'm getting an angle, a crick in my neck that way. So we don't like thick pillows for that reason. We want it to be just the right size so that you have a really nice straight line all the way down your side. And then we always, whenever we are also supporting our shoulder, we don't have our shoulder out like this, because see how that's cricking my neck right here? And it's also putting a lot of pressure on all of these other cervical muscles and our clavicle, and we can get ribs out of place, lots of things. So ideally, we want our shoulder in a closed back position like this, and under us, supporting, and our shoulders are stacked. Now, to keep this stacked overnight, all night long while you're sleeping, we ideally do want to bring our shoulder out to, or our arm out to 90 degrees. And so the way that we'll do this is best if we have a pillow laying right here on top of your arm, and then also this other arm, so that we're not like crouching like this or slouching back like that and getting everything out of alignment. We want that shoulder to stay stacked, so then you can just cuddle with the pillow right here, and then that supports that arm very nicely. All the ribs are in line, all the shoulders are stacked. Remember, our hips are stacked, our knees are stacked, and our feet are stacked. So everything is then set where it needs to be. So I always sleep with a pillow, a king size pillow between my knees and my feet, supporting my knees and my feet. And then I also have a king size pillow that's also very comfortable, nice, big, thick, fluffy pillow, but it's going to be what supports my arms. And I usually sleep in this position with my neck very nicely supported. Check out my blog posts on my website for my favorite pillows, and it will also give you links to pillows if you're a side sleeper, if you're a back sleeper, if you need a certain roll into your neck, and it's going to tell you all the different ideas for those, because there are a couple of things that we have to be aware of when we're a back sleeper. So whenever we're back sleeping, then we know we don't want your neck being crimped forward, so we don't want a very thick pillow and under our neck if we're sleeping on our back. This is very dangerous for all of these spinal nerves back here, also for the vascular flow that goes to the brain. We've got to be careful to not cut that off. So what you want to do is have a very nice thin pillow, but ideally one that also supports the lordosis, the natural lordosis in the cervical spine. That means the curvature. We have a reverse C curve in our cervical spine, and we want that supported. So we would like a pillow that gives a little extra healthy support, but then lets our head be about the same level as where our spine is, so that the spine is nice and straight the entire way through. So we also want to slightly have a superior motion to our neck, and that way whenever our head is looking up like this, we open up our windpipe, and then we get really good healthy airflow in. As we're breathing in this position, we know that we can sometimes also create a little bit less tension in our back, which can help our lungs to fully expand and breathe nice and deep breaths so we don't have sleep apnea. And the way that we do this is to help this fascia around our back spine to release by supporting our knees. So we can put a pillow in under our knees, and as that support is there, then it's going to take a little pelvic tilt out, and then we have a really nice elongated, healthy, relaxed fascia, and our stomach can expand like it needs to really get that good, healthy blood flow and oxygen that's going to carry all the oxygen up to our brain. And this also helps if you have low back concerns and low back issues anyway, because it helps to create less of that tension on that low back. So a little bit of good support and under the knees. All right, so that's back sleeping and that's the side sleeping. Now, I'll just go ahead and show you, because I know that some people feel really comfortable with side sleeping or stomach sleeping and trying to turn their head to the side, and I'll show you the reason why it's not good. So, as you can see, as you zoom in on my neck area, whenever I turn my head to the side, see how strong of a tension that puts on this neck? We'll do it the opposite way. So if your stomach's sleeping, you're putting a lot of tension right here on all the vertebrae that's in the upper cervicals of the spine. So you cannot be stomach sleeping and turning your head to the side. It's best if you can convert yourself to side sleeper and back sleeper. Most of the time, people that go through this little sleep hygiene check and really reorganize the way that they are structured at night, they don't get frustrated with side sleeping or back sleeping like they used to, and then they don't prefer the stomach sleeping as much because it's healthier, it's easier on your spine, better for biomechanics. I hope it helps.